If you're ready to travel without fear of falling, if you're ready to run without leaking, if you're ready to play without pain, then you're ready to love your life. Welcome to Love Your Life TV, where we discuss how physical therapy can help you live your best life.
Hi everybody, it's Lauren Peterson, Doctor of Physical Therapy and Clinical Director here at Physical Therapy and Balance Centers of Oklahoma City. So I'm actually a pelvic floor physical therapist, and I get asked all the time about women's health and pelvic health concerns. So today I'm going to talk to you a little bit about pelvic floor physical therapy, my favorite thing. And it didn't used to be initially. It was something I really didn't want to get into. It was a little bit strange, I thought. But I then started having issues of my own. After the birth of my first child, I started leaking when I was doing my jazzercise aerobics class. Not fun. Then I started leaking again with coughing and sneezing when I was pregnant with my second child. So then after a physician friend of mine asked me if I wanted to get into pelvic health, I gave it a second thought and decided, yes, I do want to do this. I don't want to have bladder leaks when I'm coughing, sneezing. There has to be something better. I don't want a surgical option. Let's do some physical therapy. So what is pelvic floor physical therapy? It is PT that deals with the muscles of your pelvic floor. Yes, there are muscles in your vagina, penis, buttocks, but even just your hips and your stomach, they're all part of that pelvic floor. And so really, it's your core muscles. Your core muscles are those pelvic floor muscles, your low back, your buttocks, your stomach, and they are your postural muscles. They are designed to be turned on at a low load all the time. Everybody has them, both men and women, and they really need to have optimal function to keep you out of pain, out of leaking, and even having optimal sexual function. So studies now have shown us that 60% of people just with low back pain have some sort of pelvic floor dysfunction. And most people aren't really reporting it because they don't realize there's something they can do about it that doesn't involve medication. That might just be a little pain with intercourse. It might be leaking when you cough, sneeze, or laugh. It may be urgency, having to go to the bathroom too often, even erectile dysfunction. Sometimes even constipation and painful bowel movements are things that we deal with, and they can be treated with physical therapy, and we want to help you with them. So with pelvic floor PT, we want to know, what are you missing out on? Are you missing family time because you have to find a bathroom all the time? Do you know every bathroom from here to your work because you have to stop along the way? And what is it about your dysfunction it's preventing you from doing? Maybe you can't do that favorite dance class or aerobics class. Like, I loved my jazzercise. It was very sad. Maybe it's as simple as like you're bending over to pick your groceries off the floor and you're leaking and it's driving you crazy. Could be affecting your relationship with your significant other, spouse. I've heard it all. I want to hear it from you and I want to help you fix it. So if you're leaking, in pain, or just not performing optimally, choose physical therapy, consult your pelvic floor physical therapist, and come see us down here at Physical Therapy and Balance Centers of Oklahoma City.